Welcome. On the left, we have Gloria Garcia,
Yes.
Who was diagnosed with small cell lung cancer and is receiving currently a combination of immunotherapies. We're going to hear more about that. Then we have Adrienne Skinner, who had a form of cancer that I had never actually heard about called ampullary cancer. Who's heard about that? Raise your hand. A few people, okay. Well, I guess it's a gastrointestinal cancer, and so we're going to learn about that. Dr. Belur Bhagavan is here. Now, it's strange to hear a doctor and patient all in one, but it does happen because cancer affects all of us. You were chief pathologist for many years at the Sinai Hospital in Baltimore, so certainly you are no stranger to cancer, but I'm sure it becomes very different when it's you, so we want to hear about that. And then Kerry Alvarado with pancreatic cancer. And we'll hear that was just the tip of the iceberg for you. So with that, why don't we start with Gloria. Gloria, tell us a little bit about yourself. When were you diagnosed with cancer? And then when did you learn about immunotherapy? At what point in your treatment?
Okay, I was diagnosed with the cancer at a point where I had bronchitis first. And I wasn't getting better. So I took myself to the emergency room, and they diagnosed me there a year ago in August. So they diagnosed me with stage 4 cancer, and they admitted me, and they started treatment right away.
What was the first course of treatment that you received?
Well, they did more tests, analysis, and determined that it was stage 4. I got treated with the immunotherapy. Not with the immunotherapy, I had chemotherapy first.
Chemo first, right?
Yes.
And did that work, obviously?
It worked. It worked. But then it spread to my brain. And they had to stop it. They gave me immunotherapy, chemo, for like 6-7 months. And then it spread to my brain, and they started giving me radiation. I took that for like a month, and that was pretty rough on me.
And then when did you get your first immunotherapy treatment?
I got it after the 30-day trial for the radiation.
Okay. Adrienne, how about you? What's your cancer story, and where did immunotherapy enter into that?
Okay. Well, let me start by saying that I have Lynch syndrome, which is a genetic mutation causing high incidence of digestive tract cancers, 80 to 90% lifetime risk, which I had known about for 10 years. I was diagnosed with ampullary cancer in February of 2013, and even though I had been diligent in getting colonoscopies and endoscopies for, annually for years before that, it had been apparently in place for 2 years. When they went in to do the surgery in February, they discovered that it was stage 4, that it had invaded my liver. And at that point, they started me on chemotherapy. And I went through 3 different rounds, different types of chemo over the course of the year. And it would work initially, and then it stopped. Towards the end of the year, at the point where the surgery had been attempted, they had done a biopsy of the tumor. And that particular biopsy had been sent out for genetic testing as well. And in the course of that genetic testing, they had determined that there was a microsatellite instability, high MSI. And so my oncologist at MSK, Dr. Eileen O'Reilly, had discovered this clinical trial using immunotherapy, Keytruda, at Johns Hopkins. So in 2014, April 15th, 2014, I had my first treatment of Keytruda. And so I had been through the chemo. I had been through, the washout period, as was described earlier. And within literally a couple months, they had scheduled a biopsy to go back in and see how this was working. And we could see from the markers, the blood tests that were done of every 2 weeks when I would go down to Johns Hopkins to take the treatment, that things were looking great. You know, the numbers were really looking strong. And so they moved up the biopsy to July of that year. So, you know, if you do the numbers, that's literally 3 months in. And it was an endoscopic procedure. When I came to, the surgeon looked at me and said, if you hadn't told me that you had ampullary cancer, I never would have known. There's nothing there. So it was remarkable.
So you mentioned the drug Keytruda, which is one of those we saw in Chuck's talk earlier, that PD-1, PD-L1 channel, the brake and the foot. So that's Keytruda blocks that. Gloria, you're receiving Opdivo and Yervoy,
Right.
which is another, it's a combination. One of them blocks that same mechanism and the other blocks the CTLA-4 that we saw. So that's great. Dr. Bhagavan, I failed to mention that you were diagnosed with bladder cancer, but that wasn't the first time you were treated for cancer? Did you have prostate cancer at one point?
Well, thank you very much for inviting me to be here. And having watched the proceedings here for the last couple of hours, I couldn't help but reflect. When I joined medical school in 1951, that was 67 years ago.
You're older than the Cancer Research Institute. You're 65.
I know, you are only 65. I started my medical career 67 years ago. And I had a textbook of pathology which was written by one Dr. William Boyd. Some of you might remember he was a Canadian pathologist. He was more of a literary giant than a pathologist. But nonetheless, in reading about the lymphocyte, I still remember verbatim what was said about the lymphocyte. It said, lymphocyte often congregating around the more peripheral parts of inflammation, it looks more like a passive spectator rather than an active participant. Sentence number one. The next sentence was, the complete ignorance of the function of the lymphocyte is the most humiliating gap of all medical knowledge. That was what was said 67 years ago. And today, when I sit here and everything that we are talking about is about the function of the lymphocyte. It is the lymphocyte that has brought us all together here. And we have learned so much about lymphocyte in the last 67 years. And I am proud to be part of that generation. We have come a long way. That's a comment. And as far as my tumor is concerned, I am both a provider as well as a receiver. And I'm not a treating doctor, I'm a surgical pathologist, so I have seen literally hundreds of both pancreatic and prostate cancers and bladder cancers. About 7 years ago, I was diagnosed with prostate cancer, and that was a minimal, well-differentiated cancer, and I was advised by my doctor not to get any treatment for that. However, I had a very good radiation oncologist who was a good friend of mine, and he advised that I get some radiation, external radiation, and he said he has treated literally hundreds of patients with prostate cancer and it has no side effects. And he was right. I used to work at Johns Hopkins on the 4th floor. I would go to the ground floor, get my radiation and come up and work for the rest of the day without any side effects. And that was the end of prostate cancer. About 4 years later, I was diagnosed with non-invasive bladder cancer. And I was treated with BCG
the first approved immunotherapy.
First immunotherapy is right. Immunotherapy, the BCG is an acronym for Bacillus Comet Guerin, I think. And I was receiving that, and during the follow-up, I was diagnosed with invasive cancer, at which time I underwent removal of my urinary bladder, my prostate, the urethra, and the ureters were exteriorized through a small ureteroenterostomy, and I wear a bag now. While I was still being followed, I developed a metastatic tumor in the liver, and that was treated with radio ablation. And about 9 months subsequent to that, I developed metastasis to my abdominal lymph nodes, at which time my surgeon referred me to Dr. Drake, and I was started on immunotherapy, Keytruda, and I've been now receiving it for almost about 9 months, a little less than 1 year, and I'm feeling well. I have had absolutely, well, I'll modify that. I have had no side reactions excepting for a little joint pain at one time, and Dr. Drake was very cautious. He said it may be a side reaction, but that disappeared within a couple of weeks. So I haven't had any side reaction. My quality of life has been excellent. I do international traveling, local traveling as well, and I take care of myself, and I'm feeling very well.
Wonderful. Kerry, what's your story?
Well, I was first diagnosed with breast cancer in September of 2014. I was lucky enough to have a lumpectomy and intraoperative radiation, so I didn't have to have any chemo for that. Then in October of 2015, I was diagnosed with stage 3 colon cancer. My surgeon at Columbia was able to perform a partial colectomy, taking 2 feet of the colon. And it had hit some of the lymph nodes in the area, so I had to have chemotherapy, which I did for 6 months. Then after that, I went for a follow-up, 1-year follow-up colonoscopy, and he said everything looked fine. I went home, and about a week later, I had excruciating pains in my stomach. I went back to that doctor, and he said, well, I thought maybe he punctured something during the colonoscopy, or I wasn't quite sure. Went back to him. He said, well, let me send you to get a CT scan. They found a tumor in my pancreas. And I immediately wanted to come back down to Columbia again. And I saw Dr. Chabot, who's one of the better surgeons at, pancreatic surgeons. He was able to operate, and originally he thought he was just going to take part of the pancreas. Ended up going in, and it was a lot bigger, the tumor, so they had to take the whole pancreas, the spleen, and the gallbladder. Wow. I recovered from that. I became instant type 1 diabetic. That was unfortunate. Then I had to do chemo because it also hit some of the lymph nodes in the area. Did that for about 6 months. Everything seemed fine. About, I guess, a week after, I ended up having another issues with my stomach, excruciating pain again. Not as bad as the pancreatic pain, but bad enough. I went to my local hospital, and they did a CT scan, and there was a tumor in the pancreatic bed. So at that point, they suggested I try chemo again, which I did. It was a very hard chemo, hard on the body. I lost a lot of weight. I was very ill. And it turned out that chemo did not work. The tumor grew. So at that point, I went back down to my pancreatic surgeon, and he suggested I speak with Dr. Manji, who you met earlier today, and discuss my options.
And did he recommend immunotherapy to you right away, or how did
we talked about, you know, there was another, I guess, standard of care chemotherapy that I could have done. And then he started to speak about it. My mother was with me, started to speak about immunotherapy, showed us a video, which I hadn't heard about. I mean, I might have heard it in passing, but never thought I would ever have to do anything like that. And he explained a lot about it, gave us information, showed us a video, told us to go home to think about it. And I thought about it, and I went for it.
And what exactly were you prescribed? What are you receiving, or what did you receive?
It is pembrolizumab, which is the yes, that one, and azacitidine.
Which is
that's the combination.
Right. Okay. So since we just heard about your side effects, all the horrible response to chemotherapy, what has the response to the combination been since you started receiving that?
I haven't really had too many side effects. I had a little nausea, but I take, you know, pills for that. I've had, I did end up being diagnosed with hypothyroidism as a result of this, but I take a pill for that. And I had a lot of severe joint pain, but I'm taking a very low dose of steroid, and that's gone.
And
how
are you doing
great
today? How do you feel?
I feel perfectly fine.
That's awesome. Now, it's very unusual to hear of people who are diagnosed with multiple cancers, and as far as you know, you've been screened, I imagine, for everything, and nobody can figure out why, right? It's extremely frustrating.
I've had genetic testing, no history of any cancer in my family, so they don't know yet.
Wow. Adrienne, when did you know that immunotherapy was working for you?
Within the month. It was clear that the numbers were, it was evident. I started with CA19 in the tests as I began at 170, and within the month it was below 40. I mean, it was remarkable. So it was, you know, 2 to 3 doses in. Yep.
Gloria, when did you start feeling better at any point?
I felt better about a month, and within a month's time, I felt energetic. I didn't feel weak. I was able to walk better. My balance was still a little off, but I felt the difference immediately.
Wonderful. Dr. Bhagavan, same question. When did you, how early on after receiving immunotherapy did you begin to feel better or have a good response?
When I started, I was feeling quite well. And as a matter of fact, I wasn't sick at all. I had just come back from India, traveling, and I met with Dr. Drake, and he started me on the treatment. And at the end of 3 months, the imaging studies showed that the tumors had shrunk. So that was when I learned, but I was clinically feeling well all along.
That's great. Kerry, so you got your treatment as part of a clinical trial.
Yes.
Right? So how did you learn about clinical trials? Who told you about them, and what sort of questions did you have when you first heard about them?
Dr. Manji mentioned clinical trials. You know, what kind of side effects will I have? How, you know, will I be able to work? How many times will I have to be at the hospital for the clinical trial? I'm trying to think of what else. I had so many questions, but I it didn't matter. I was going to go for it anyway.
So did you have any qualms, any fears about it, concerns?
The only fear I had is, what if it doesn't work?
That's what it comes down to.
That was it.
Yeah.
Yep.
Adrienne, how about you? You also participated in a trial.
I did.
How did you learn about clinical trials, and what sorts of questions or concerns did you have?
So my doctor, Dr. O'Reilly, had basically said, this is your best option. And I trust her implicitly. We had been using a third round of chemotherapy drugs. And she said, we can keep going. There may be other alternatives here with the chemo, and I have some other, and she said, it tricks up my sleeve. But she said, I found this clinical trial, and based on the genetic, report from your tumor, I believe this is your best option. And that was good enough for me. I mean, my bigger problem was getting them to take me. I did not have concerns with respect about the clinical trial itself, because in my eyes, I was going to be dead within 6 months. It was pretty clear that unless something started working soon, I was a goner. So she felt very strongly, and therefore I felt very strongly. So the fact that my numbers, if you will, the liver enzymes and the things that they track through the blood were so erratic because of the washout period, they were very concerned and weren't sure that they were going to take me. But I was strong and still working and playing tennis, and other than the cancer, I was relatively healthy. So that was my pitch. Literally, I've been in sales for 40 years, if you can't tell. And I said, I understand there's parameters, but I also know that this is, it's hard to find people who are willing to step into clinical trials. I'm here now. I'm ready for it. I'm absolutely 100% in, and please take me. And so she turned me away. This was the head nurse, reluctantly, but the doctor wasn't available that day, and said, I'll get back to you, but, we really can't take you. We can't treat you. So I went back home, and I'll never forget this. The next day, I'm standing in line at Trader Joe's with my little basket of stuff, and the phone rings. She says, if you can get down here tomorrow, we'll treat you. I'm like, I'm there. Thank you. Hung up, ran out the door, ran home and bought my train ticket, and I was there the next day.
Wow.
And that's how it started. So
that's wonderful.
Yeah.
It's good that you got that option.
Yes.
And that you found it so relatively quickly compared to others who have to just keep at it and keep at it and keep at it until they get into a trial. So that persistence is key. So I'm just going to dwell on clinical trials for another moment. And Kerry, where are you now? Like, how do you still receive treatment? How often do you receive treatment? What are the kinds of scans and things that are involved in participation in a trial for you?
I started the trial in April of this year. I guess I'm in my 20th week. I can't remember if it's the 20th week. Basically, my schedule, if you will, what I have to do is I have a cycle of 5 injections. So I come down 5 days a week, Monday through Friday, and I get an injection. Then that's every 4 weeks. And then every 3 weeks, I come down for an infusion, which takes about 40 minutes. But in the meantime, the first, when I come down for the first shot, I see, I get blood work done. I speak to Dr. Manji, his staff, although they're there all the time, every time I come down. What was the other question you said?
Just, what sort of, are there other scans or
So every 8 weeks I get scanned. Well, in the beginning I had a scan and a biopsy. And after the first 8 weeks, I had a scan and a biopsy, like I said, and the tumor shrunk by almost a quarter. Then after 16 weeks, it shrunk by almost half. That's where I am right now.
Excellent. Yeah. Thank you, Dr. Manji.
Yes.
So, Adrienne, where are you now in your trial? How much are you participating? What's expected of you?
So I completed. I went to the full 2 years because I went back after about 4 months to Dr. O'Reilly and said, hey, it's pretty much finished. What do you think? And she's like, keep going. You've got Lynch syndrome. It's kind of an insurance policy for me. So every 2 weeks I went down to Johns Hopkins for 2 years. I completed in April of 2016. I go for scans every 6 months. Initially it was every 3 months. They draw research blood at that time, and that's it. I mean, I'll go to every year, I think, next visit.
Wow.
Yeah.
I just want to do a quick time check. It says 20 minutes down here, but is that 20 minutes for Q&A remaining? 5 more minutes for questions? Okay, well, let's take some, sorry, this is wonderful. I'm sure there are a couple questions from the audience. If you don't get an opportunity to ask your question now, find our guests later in the day. Yes.
Hi, my question is for Kerry. Kerry, you said that breast cancer and then colon and then pancreas. Mm-hmm. Was it metastasized breast cancer to your colon and pancreas, or was it 3 different cancers? And best of luck to you.
Oh, thanks. They basically don't know what the they don't know what the origin is or how they're connected, but they are connected somehow. They just don't know yet.
We have a question over here. Oh, no, hold on, I'm sorry. We have one with the mic. We'll get you next.
Yes, I'd like to know why organizations such as yourself are pressuring the FDA to allow immunotherapy to be used as frontline treatment, which is a less invasive procedure and less dangerous than chemotherapy.
Mm-hmm. That's a great question. So just to read, our organization is a research organization. We're not an advocacy organization, and organizations that their role is to lobby government to make policy changes are true advocacy organizations. That's not us. But there are a lot of organizations out there that are advocating for that. Again, though, the important thing is it's got to be based on good science and good data. And you can't just say, I'm going to give you this with no evidence that it's actually going to help patients, because you might wind up doing harm as a result by not giving them something that they might work with. I think, though, you raise a very important topic. And I know we certainly would love to see immunotherapy used earlier on, and we would love to see people not have to go through the painful side effects of some of the standard treatments. I don't know if anyone else has anything to add to that. Yes, Dr. Manji?
So I think that the important thing is, for pancreas cancer, sorry. I think it's important for me to mention this because I get a lot of consults and patients. The reason that it worked for Kerry is because we had the genetic analysis, we had the mutation analysis. She had a mutation in a different gene, not with MSI high, that told me that the likelihood of immunotherapy working is high, and that's the reason why we were confident. So I don't want the message to be that pancreas cancer immunotherapy great, right? So that was studied in all patients with pancreas cancer, and unfortunately did not work. So it's really important that, again, you have to make sure that every tumor has its own neighborhood, and you want to make sure that your tumor is in a neighborhood where immunotherapy works. So many patients come to me with pancreas cancer and say, just give me immunotherapy, it doesn't matter to me, and I have to explain to them that actually that is probably not beneficial. So that's really important.
So the question was outstanding. Throughout multiple tumor types, we're trying very hard to make immunotherapy the first line. And in bladder cancer, if the tumor expresses the biomarker, the PD-L1, then it is standard of care. Dr. Bhagavan didn't mention, actually, that I did offer some chemotherapy, which is a standard first-line care. And he actually, I don't know if you remember this, but he adamantly refused, actually. And so based on that, we're going to try immunotherapy in the first-line setting for pancreatic bladder. For kidney cancer as well as a standard of care, but it definitely depends on the patient, on the biomarkers, and on the different cancer types.
Thanks. I think we have time for one more question.
The question that I had is about MSI. Someone has an MSI number. Is that number static or can it change? Does somebody have a different MSI number before cancer, or if their cancer profile changes, does the MSI number change?
No.
Your cancer is either unstable or it's stable. It doesn't change that. You have MSI or right? And actually, one point that we didn't do a good job bringing out is every single cancer, okay? Every single cancer, there's a small fraction of patients who are MSI. So in prostate cancer, it's about 2%. In kidney cancer, it's about 4%. So really, honestly, patients, this is not widely known. If you don't have a good standard treatment, the tumor should be tested for MSI, actually, because if you have it, then immunotherapy has a high chance of working, sometimes for a very, very, very long time, actually, even leading to cures, perhaps. So everybody who has a cancer should consider to get MSI testing, actually. It's not really hard, either. It's a standard pathological test.
That's right. Alice, do we have any questions from the live stream? No? Not right now. Okay. So I would like, does anyone have just one more question for one of the panelists? Yes. Please wait for the mic. You're going to get that. It's right there. There you go.
I think that it kind of goes along with what was just said. I have a daughter who's only 28, and she got breast cancer, stage 4, starting when she was 21, no BRCA. The thing we had trouble with, were you tested for things like PD-1? Was your MSS ever tested? We went through constantly fighting to be good for pathological workup. So I know what she has. She's finally been saying she's HER2 low, but we were forced into treatments where I knew they would not work. And I would tell them, why are you going to do a HER2 treatment when you know she's low? Where it's not, the tests aren't coming out there. Did you get the pathological workup ahead of time so you could make choices or people would properly advise you? We got Foundation 1 twice. We did Agendia, we did Clariant. Just this last year, finally got a nurse saying she's stable, so the immune won't work. How do you get it? And why is it standard?
I'll just start by saying some approvals by the FDA require that you be screened for the expression of some of these markers. But let's hear maybe individually, each of you, what kind of screening you may have had. If you had, any of you have that? Certainly the ones receiving.
I mean, for any of my,
was there any genetic testing done to see either on your tumor or you to see that whether or not you may be more likely to respond to an immunotherapy?
As far as the pancreatic tumor, I believe there was genetic testing done on it, yeah.
I was just informed that in the bladder cancer, regardless of the markers, these immunotherapies, sometimes work, and so I was started on that no markers were done.
Okay.
In my case, genetic testing was done for Lynch many, many years before I got the cancer, so we knew. The other, Dr. O'Reilly knew also that with Lynch syndrome cancers, the chances of a high MSI is very significantly likely. So it was an easy decision to get the testing done by Foundation, which is what she did, with the biopsy of my tumor. So it was a pretty straight path. There was no question there about getting the testing, and it did indeed prove that the high MSI was there, and therefore the clinical trial was a good choice.
I'm not sure what kind of test I got, but I believe I had a thorough checkup and analysis, and I have a wonderful team. I trust them. They made me feel very comfortable, and I was in their hands. I said, my life is in your hands, so you do what you got to do. And my son, my wonderful son, he took a course in the immunotherapy and everything else, so he was very well informed. So he knew what to expect.
I really wanted to get a question about the caregivers in your life and the role that they've played. Unfortunately, we don't have time to get to that right now. So we need to wrap this up and move on to the breakout sessions after the break ahead. So let's give our panelists a round of applause.